Hi, I am a 49-year-old who's been diagnosed with, and this is going to be a mouthful, de novo metastatic castration-sensitive prostate cancer. Was diagnosed on Memorial Day of 2023, and I do these videos to let my friends and family know what's kind of going on, what the latest is, and anyone else who's going through the same journey with me. I'm not a doctor, so please understand that anything I say here today is just things that I'm going through, my opinions only, and are not to be construed as medical advice. So this video is about a week later in recording than I wanted it to be, and that's primarily because I got sick again. Of course, the first time I got sick recently was after my 6th and final round of chemotherapy, which was on January 11th, and after that round, I proceeded to get a head and chest cold, or I think it was primarily a head cold, and just really felt like crap, basically. Went in, found out that I had, imagine that I had a low white blood cell count, so which was shocking after 6 rounds of chemotherapy, and yes, I am being sarcastic there. But anyway, I got over that just in time to have my port removed, and excuse me. I went to New Orleans to celebrate that removal about a day later, to celebrate that with a weekend of Mardi Gras. Of course, the weather in New Orleans being like it is here in Florida, where it's just very mercurial, it was cold and wet that weekend. So I proceeded to get another head and chest cold, which I am getting over, hence the lingering cough. But I'm getting there, and so here we go with this new video to kind of let everybody know what's going on. PSA is still at 0.04, so there hasn't really been a change there. The last time I did a PSA check was right before or after my last round of chemo. I probably won't have another PSA check until my next visit to the urologist, which will be in April. So we're now gone from monthly PSA checks, and now that my PSA seems to be stable, within range, I won't be having them now until every 3 months. So, which will be coincident with the injections that I get. So the reason why I was going to do this a week ago was because of the port being taken out. The port is out; it's gone. So the port, for those of you who don't know, is the device that I had implanted right here, and it has a cord that went into the subclavian artery, and it was used to either draw blood for those nurses that were skilled in using a port to do that, and primarily to administer the chemotherapy, the docetaxel or Taxotere, they're both the same thing. Or to administer that chemotherapy and the steroids and everything else that went with it. I hated that port primarily because before I had the port inserted, the doctors told me that they didn't want me sleeping on the left side. So that meant for, the last 18 plus weeks, and I say 18 plus because we had to push one of the 3 weekly chemotherapy sessions out an additional 2 weeks. So I guess about 20 weeks was the whole ordeal. But in the last 20 weeks, I've only been able to sleep on my right side, so not my left side. And of course, they told me that I wasn't able, or I should not be getting it submerged, even though it was completely buried under my skin. So I don't know really where that came from. And they also told me that I shouldn't be doing much, if any, movements over the head or any type of resistance training, because they did not want to aggravate the port or get it to flip over or do something else like that. So needless to say, it was pretty annoying, especially because as a male on androgen deprivation therapy, not having any testosterones, one of the things that they also tell you to do is to do weight training or resistance training to maintain your bone density, maintain as much muscle mass as you can, because you lose a ton of it, and I can attest to that fact. I have lost a lot of muscle mass. And of course, the annoying point we're getting we're getting in here to the actual port removal itself is, so I go to the doctor, the surgeon who actually performed the implantation, so to speak, and he's getting me prepped, and he's asking, he's like, hey, so you're getting it removed earlier than most people do, because as I mentioned on the previous episode, the oncologist wanted to leave it in for a year. Not every oncologist is like that. My new oncologist says he would completely agree and would have had me getting it taken out as soon as I could after that final round of chemo. But anyway, he said, hey, why are you getting it taken out? And I said, well, doc, because I want to really get back into my aggressive weight training and my resistance training. I want to get back on the water. I want to start swimming again. And of course he said, well, why? Not why, but he said, okay, well, why do you think you couldn't do that because you've got a port in? And I said, well, because you told me I couldn't do that if I had the port in. You said, don't do that. And then he thought about it for a little bit and he said, yeah, I guess so. Yeah. I mean, if it's irritating your port and whatnot. So again, the stuff with the doctor is telling you one thing and then telling you the next day, telling you the opposite of what they just told you. It can be a little frustrating. Another reason why you really need to be your own advocate. You and only you need to be comfortable with the decisions that you make as far as your treatment goes. You need to be absolutely comfortable with them. So there you have it. But back to the actual removal of the port, which was an adventure. So, of course, he had me take the shirt off. I was laying on a table inside one of his patient's rooms. My wife got to be in the space with me, and he puts this plastic sheet over me. Basically, it covers my head, so I really can't see what he's doing, but it has a hole cut out to where he can actually perform his work. So he tells me what he's doing before he does it, as any good doctor does. And he's saying, okay, so first thing he does is administer a local anesthetic to numb up the area before he starts cutting on me, which I'm appreciative of. And he puts in a full syringe and is kind of massaging it around, waiting for it to take effect. And then he says, okay, I'm going to poke you with a needle. You tell me if you can feel it. So he pokes with a needle, and I'm like, yes, I can feel that. I was like, all right, let's wait a little bit longer. Just massaging it around. And then he says, okay, I'm going to poke you with the needle again. Pokes me with the needle, and I'm like, I can feel that again, just as well as I could feel it before. And so, of course, it's not just one poke. He's poking around. I'm like, I can feel that. So then he's doing it again, and he's doing it. And this time he doesn't tell me. And of course, I can feel him poking me in the chest with a sharp needle. And I say, Doc, I can feel that. So after that, he has the nurse or his assistant bring him another syringe of the local anesthetic, and he puts another syringe in. Waits a little while, says, okay, I'm going to poke you with the needle. Pokes me with the needle, and I'm like, Doc, I can still feel it. By this point, he and I are, he's a little confounded, and I'm just getting kind of frustrated because I'm anxious. I'm anxious to get this port out. I want to get the show on the road. And I'm not going to let a little poking prevent that. And I could feel the poking. It felt like a needle being poked into me, but it wasn't anything excruciating. So, and it wasn't everywhere, but I could definitely feel him poking in certain areas that he was going to be cutting on. So I just say, you know what, let's just do this. And he was of the same mind. So he starts cutting, and thankfully I couldn't feel him cutting. So he starts cutting, and I could feel him tugging to try to get it out because there's a pretty long cord. If I can get it up, I'll show you afterwards a picture of what it looks like. And just be warned, it's graphic because it's been inside me, but they clean it up a little bit, so it's not like it doesn't have pieces of meat hanging off of it or anything. But I will show you that picture hopefully here if I can get it. So anyway, as you can see, that's what the port looks like. But it took a while. I would say probably about 5 to 10 minutes, maybe a little bit longer of him fighting with it because the port really had found a home inside me. And I think the port really didn't want to part ways with my subclavian artery, as evidenced by how long the doctor had to fight and his subtle comments to that effect under his breath. So he gets the port out eventually, and I feel very relieved at that. And then it comes time for him to suture me up. And as he starts doing it, I have to let him know that, hey, doc, I can feel that needle going through those layers of skin. I can feel the thread going through. I can feel what you're doing. And but at this point, we're past the point of no return. As the doctor said, he needed to stop the oozing. And at first, I thought he was talking about maybe the port having been infected or something, or obviously the tissue around the port being infected. But no, that just was his word for bleeding, I guess. But he just kept saying oozing. But anyway, point being, I could feel him stitching me up. It took a while, or at least it felt like it took a while for me. And me saying that, the biggest thing is, the only thing I had going through my mind at the time was that scene in Roadhouse where Patrick Swayze is getting stapled by the doc, and he's refusing any type of anesthesia, and is just, saying, let's do this, or whatever. So I guess that must be what Patrick Swayze felt like. But anyway, it was not that uncomfortable. It was a little uncomfortable, but really not that bad, especially because I had the endorphins of knowing that I had the port finally taken out. So long story short, port came out, no port. I'm able to sleep on my left side again, move my arm up and down and around. The doc had said that I should be expecting, some bruising, because I did bruise after they put the port in. And he said then I should probably expect bruising afterwards, but I really haven't had any. I still have my steri strips on. Again, it's been about a week and a half. If they're not out by a Thursday of this week, I'll probably just go ahead and take them off. It itches, so I assume that means that the skin is healing. And other than that, I'm just he did say give it a little bit before I really start doing the resistance training. So again, that's probably going to be till Thursday, and then I'm gonna take the training wheels off and get back to the exercising. And I can't wait. So what's next? Well, what's next is I am trying to get scheduled for a second PSMA PET exam. I had one, if you remember, the week after initial diagnosis, and that's what found the metastasis to the lymph nodes all over my body, basically, and the two mets in my bones, one in my hip, and then a really small one on my T8 vertebrae. The results of the second PSMA PET are going to determine whether I fight for going down the path of radiation, especially if everything has been localized back to the prostate, then possibly radiating the prostate itself, or whether or not I look at maybe a different treatment like Provenge, or if I just stay on ADT for a while longer until I get a treatment holiday and we see what the cancer does. So that's kind of where I'm at. Of course, the doc did tell me, my new oncologist told me, that he had been having issues getting follow-up PSMA PET scans, especially for the men whose PSA, like mine, is almost undetectable. So, because of course the thought being, well, why are we going to put radiation in you if it's not going to have any prostate-specific membrane antigens to latch onto? Well, for me, it's important, and I think for the doctors as well, to have that follow on to really know where the cancer is or isn't anymore. Because of course, if they give me the PSMA PET and I find out that, nope, I still have several lymph nodes that have some of the cancer in them, or the mets on the bones haven't gone away, or if I have new mets, then I'm not going to go down the path of radiation. And so the PSMA PET really is there to decide, or help me decide, what the next step in this journey is. And so anyway, I haven't yet heard from the hospital in Pensacola that does them. And I do believe I heard from them a little bit earlier than this the first time. Well, I had to have. I heard from them within a week on the first time, and now it's been about 2 weeks and I haven't heard from them. So we might be fighting that battle, which is a pain, but I can't have the PSMA scan done until 4 weeks after the last chemotherapy, which is coming up here soon. But anyway, point being is I've got some time. I couldn't get it done tomorrow anyway, even if I wanted to. So PSMA PET, and then of course the next set of injections, the Xgeva and the Eligard, are scheduled for April. So, that's kind of where I'm at. There's a lot more to it than that, but I don't want to make this video any longer than I have to. The only other thing that I want to mention is that my shipmate and buddy Jason, who's also another stage 4 prostate cancer patient, he's one I talk about a lot on my podcasts because I get a lot of really good things from his podcasts, and he's in a different boat than I am. But in a lot of ways, there are some similarities. But he started doing some live streams, and his next live stream is going to be this coming Saturday, the 17th, at 10:30 Central Standard Time. I will be watching that live stream, and I hope you do too. Who knows? Maybe I might get a chance to ask a couple questions or participate in the video. Who knows? Anything is possible, right? But that really is it. Ports out. I kind of feel like I'm getting back to normal. I know it's going to take a while for the effects of the chemo to wear off. If you go back to look at my first video, and then you look at me now, this Emperor Palpatine bleached eggplant look, the no eyebrows, obviously no more beard. It's definitely taken a toll physically on me, and I'm looking to get that, the guy from the first video, I'm looking to get back here as soon as I can, but it's going to take time. And I will be patient because I know that true healing takes time, knowledge, and daily action. And that's what I'm going to do. So until next time, hopefully that being next Saturday for most of you, just remember that it is a great day. Thank you so much for all the comments and the support. And most importantly, remember, anything is possible.